Hello, I'm Dr. Jack Adrian of ChiroCenter, and today I would like to share with you the many different variations of challenges that can cause a condition known as carpal tunnel syndrome. When we talk about carpal tunnel symptoms, which are usually characterized as pain, numbness, tingling, swelling, and or weakness in the wrist, hand, and or fingers, they can affect one hand or both hands, and the cause of the problem can actually come from three different combinations. Now, these combinations are called true carpal tunnel, false carpal tunnel, and a problem known as the double crush phenomenon. Before we explore these combinations, I would like to take just a minute to share information with you about the carpal tunnel itself. The word carpal refers to the 8 dime-sized bones that make up each of your wrists. Now, on the palm side of your wrist is a ligament band stretching from the thumb side to the little finger side of your wrist, known as the carpal ligament. This ligament, along with the 8 dime-sized bones, make up what is known as the carpal tunnel, which is a tight, narrow opening in the wrist just large enough for the nerves coming off your neck to get into your hands and fingers. The intensities of carpal tunnel range from slight tingling to deep numbness, mild discomfort to severe pain, or simple weakness to severe loss of strength, often causing one to be unable to open a jar or even hold a cup of their favorite beverage, and are found mostly in activities where people must use their hands in repetitive motions over and over again, such as someone who types all day, turns hand tools with their wrist, and uses heavy vibrating equipment, or those who sort parts and equipment on an ongoing basis, just to name a few. Now, it is very possible to have carpal tunnel symptoms without actually having carpal tunnel problems. As a result, carpal tunnel must be viewed from 3 different perspectives for an accurate diagnosis. So let's take a look at these from all 3 angles. First, an individual may actually have nerve compression only in the wrist. This is known as true carpal tunnel. When swelling inside the tunnel becomes severe, often brought about by wrist bone misalignments, this swelling causes compression of the nerve in the wrist and is the cause of direct carpal tunnel symptoms. Again, this is known as true carpal tunnel. Second, a person with symptoms in their hands, wrists, and fingers may not be dealing with carpal tunnel at all, but rather because of pain that is referred or travels down into the hand because of nerve compression in the neck. This is known as false carpal tunnel. You see, nerves from the neck flow down the arms into the hands through the carpal tunnel. If these nerves are compressed in the neck, they frequently refer pain into the forearm, wrist, or hands, even if no neck pain is involved. Again, this is called false carpal tunnel because it mimics true carpal tunnel. And in these cases, it does little good to focus on the wrist and hand because this is not where the pain is coming from. Third, an individual with carpal tunnel problems may be dealing with nerve compression in multiple areas, such as the neck and the wrist. This is known as the double crush phenomena. The nerve causing the pain is compressed or crushed in 2 or more different areas. Double crush is very common, and there's a good chance you may be experiencing the double crush phenomena if you have problems in your neck as well as in your wrist or hand at the same time. Especially true if you have problems in your neck as well as both hands and both wrists. When a nerve is compressed in multiple locations, it can greatly exaggerate the pain. This leads to a high chance of misinterpretation, and it's therefore very important to find where the cause or causes of the compression are to determine whether you are experiencing true carpal tunnel, false carpal tunnel, or the double crush phenomena. Now, in a research study where 1,000 individuals with carpal tunnel symptoms were studied, 40%, that's 4 out of every 10 individuals, were found to have multiple areas of compression. Now, this is significant to know if you are someone who is contemplating surgery. And the good news is that through specific chiropractic procedures, carpal tunnel surgery can very often be avoided. Our approach here at ChiroCenter regarding carpal tunnel syndrome is to provide examination to all possible areas of where the nerve can be compressed to better determine the exact location of your related symptoms. Once located, and depending upon the challenge, we then go to work to do our best to reduce carpal tunnel swelling by bringing about structural realignment back into the bones of your wrist, your neck, or both, in order to have the best chance for a successful non-surgical outcome. Now, the majority of people respond very favorably, and many patients report significant relief and/or total resolution of carpal tunnel problems through specific chiropractic procedures. If carpal tunnel is causing you concern, give me a call here at ChiroCenter and let's take a look and see if a non-surgical solution for the problem can be had. It just makes sense to find out before risking your hands to surgery, and this is especially so if you're someone who relies upon your hands to earn a living. I do hope this information has been very valuable to you. From ChiroCenter, I'm Dr. Jack Adrian. All of us here at ChiroCenter look forward to being of service to you, and thank you for watching.